It was Tuesday morning. I went to the ward. The consultant gave me a very simple job, which was to do a blood on a 90-year-old female who has a calcium of 3.65, 3.65. That's a high level of calcium. Normally, the result is 2.2 to 2.6. So you can see that her calcium is very high, like super high, like dangerously high, too high. She has a background of heart failure and dementia. She is currently on 3 liters of fluids, trying to reduce her calcium level, as well as she was really delirious, according to the nurse. So I went into the room. She was sleeping peacefully. So I woke her up and straightened her arms to look for any veins. She was really confused. She wasn't able to understand what I was talking about. She was unable to form any conversations with me. But the moment I tied the tourniquet, she started to shout, like scream, like pain, 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 pain. And immediately my heart just softens, like, oh my God, like, oh God, I'm so sorry. Like, oh. And she started to cry as well, crying tears. It says, oh my God, uh, well, maybe tomorrow, like maybe this afternoon, like, sorry, sorry. And then you started to say tons of millions of sorries when removing the tourniquet. "Ah, I'm sorry, I'm sorry." I came out of the room, I went to the consultant and said, look, she's crying. She clearly doesn't want it. Can we do it tomorrow or this afternoon? Does it have to be urgent? And the consultant just asked me to follow him. Went back to the room, quickly assessed her capacity. She clearly doesn't have any capacity to make any decision because she was so confused. So the consultant asked me to hold her arm down, apply the tourniquet, quickly get the blood done. She was screaming in a loud volume. The whole ward can hear her. I'm thinking that we're torturing her. She's like, pain, pain, pain. But then the consultant was really calm. Just, okay, it's almost done. And then just get the blood done. On the way out, he told me that, Chris, like this blood is very important because she has a background of heart failure and high calcium with the treatment of fluids. We need this blood to know that whether we should continue the fluids or not. And it is in her best interest. Although it could be painful for her, but it is in her best interest. So we have to be assertive and not being that soft. Her calcium level came back as 3.64 from 3.65. So she got more fluids. The next day, same job again. I went back to her. Same thing. She was crying. She was shouting. And still no capacity to refuse the blood. Even though my heart was really itchy, really tingling, having like tiny needles just poking me. But I forced the blood. So I did the blood. It's not nice to do these kind of things to the patients, especially when they are crying. They don't want it. They don't want us to give them cannulas, bloods, ABGs, random medications. But being nice all the time and being soft, kind is not the best attitude all the time, especially for these kind of situations where patient has no capacity to make decisions and the management plan is in their best interests despite it being painful and unpleasant for them. So I learned to sometimes balance out the assertive and cold-hearted between the warm, kind, smiley attitude. Sometimes you do need more authorities and coldness towards your management and do it despite patient is refusing it. but in the condition of patient has no capacity to refuse, all right? Overall, she got well. Her calcium level went back down to normal level, and she is currently medically fit for discharge, just awaiting for a package of care, so some social involvements. If you have a similar experience or something that you learned that is relevant, feel free to comment below. But thanks for watching, and I'll see you in the next video. Bye.